Hello, my name is Scott Eschete. This is a video presentation on today's modern healthcare delivery system. Today's modern healthcare delivery system is a complex and sometimes confusing machine made up of many moving parts that work together to provide healthcare coverage for U.S. citizens. The text states that it is a kaleidoscope of financing, insurance, delivery, and payment mechanisms that remain loosely coordinated. Because the system is so intricate, it is important for us to understand how it works. First, with a full understanding of how the modern healthcare system works, we will be able to fully utilize it to provide the most effective care for all patients and reduce inequities of healthcare. Secondly, as Wagner states, if we are to be effective as healthcare leaders, we need to have perspectives on the various aspects of the systems, and we need to support those perspectives with research and facts. Patients rely on healthcare leaders for their healthcare information. As leaders in healthcare, we need to be able to provide them with evidence-based facts in order for them to not only receive the best care available, but also get that care at the most affordable cost possible. The U.S. healthcare system is made up of three primary parts: the providers who directly care for patients, the settings in which general health care takes place, and the purchasers who are responsible for paying for acquired healthcare services. The first cog in the healthcare delivery machine are providers. Under the strictest of definitions, a healthcare provider is defined as a doctor of medicine or osteopathy, podiatrist, dentist, chiropractor, clinical psychologist, optometrist, nurse practitioner, nurse midwife, or a clinical social worker who is authorized to practice by the state and performing within the scope of their practice as defined by state law. However, a provider can expand beyond this definition into anyone that offers any type of healthcare services, such as a dietitian, audiologist, or physical therapist. There are also indirect care providers. An indirect care provider might be someone who works in the lab to complete a lab test, but this provider may never see the patient. All of these healthcare providers play an integral role in the healthcare system. Providers are the link between the patient and healthcare. According to the National Library of Medicine, a provider's primary role is to maintain the general health of patients through application of the principles and procedures of modern medicine. This can be done directly and indirectly to the patients. Nurses, physicians, and allied health professionals care directly for the patient in acute care facilities or outpatient facilities. Indirect care can involve lab tests or radiological tests that are read and interpreted by healthcare professionals away from the patient. Providers can create or address inequity in a number of different ways. Providers often rely on insurance companies as their primary source of income. Many providers choose not to accept certain types of income, such as Medicare or other low-income insurance policies. In doing so, healthcare providers cut off a certain socioeconomic group from their scope, thus creating disparities. The National Academies of Science state that access can be seen as a continuum. Even if care is available, many factors can affect ease of access to it. For example, the availability of providers who will accept a person's insurance, ease in making an appointment with a given provider, the ability of a patient to even pay for care, even if a patient is insured due to cost-sharing co-payments and deductibles, and the difficulty of arranging transportation to and from healthcare facilities are other factors that create inequity. Providers are able to create inequity by making it difficult to make an appointment. When it is difficult to create an appointment with a given provider, patients will sometimes become so discouraged that they will give up entirely. Pricing of services that the providers render can also create inequity. With high deductibles and co-payments, high provider pricing increases the amount that comes out of a patient's pocket, making it difficult for the patient to follow up with the provider's services. Lastly, location plays a major role in provider inequity. Low-income households often may find it difficult to find transportation to get to a provider, which ultimately will exclude them from receiving care. The second factor in healthcare delivery systems are settings. Settings is a general term that represents healthcare services or locations. The CDC states that the term healthcare settings represent a broad array of services and places where healthcare occurs. This can mean an array of places such as acute care hospitals, walk-in clinics, outpatient surgery centers, dental offices, and optometrist offices, to name only a few. Healthcare settings are not limited to only professional locations. As previously stated, a healthcare setting is anywhere healthcare takes place. Oftentimes, people are unable to leave their homes. In this case, nurses or other healthcare professionals will do visits to a patient's home. In emergency scenarios, ambulances transport patients to and from an acute care facility. These are also considered healthcare settings. Settings affect healthcare inequity in much the same ways that providers do. Certain settings and services, such as hospitals or clinics, sometimes only accept certain insurances. If a patient does not have their specific insurance, then care is not provided. Other patients will avoid going to certain locations or receiving healthcare at home because pricing may be too high, regardless of insurance coverage. The primary factor affecting inequity is location. In much the same way that providers' location affect inequity, settings cause the same issue. Low-income families are unable to attend these settings if transportation is a difficult issue. The last piece of the healthcare delivery system puzzle are purchasers. Perhaps the best way to define purchasers is to define the act of purchasing. The World Health Organization defines healthcare purchasing as the process by which pooled funds are paid to providers in order to deliver a specified or unspecified set of health interventions. By this definition, a purchaser may be any entity that provides these pooled funds to pay for healthcare goods and services. The three major healthcare purchasers are the governments, insurance companies, and individual consumers. The government provides health insurance for a large portion of low-income families, elderly, and pediatric patients through three primary programs: Medicare, Medicaid, and the Children's Health Insurance Program. Funding through these programs is provided through tax revenues and are used to pay providers. These healthcare programs seek to eliminate healthcare inequities that poverty creates by providing for those beneath a certain poverty limit. Insurance companies function in a similar fashion as government-provided insurance. Members who subscribe to private insurance companies, such as Blue Cross, pay a monthly premium. The premiums paid by members go into a large pool, and when members need to seek medical services, a portion of that service is paid for by the insurance company. Private insurance companies contribute heavily to healthcare inequities. More often than not, insurance companies are expensive, deductibles are high, and in some cases, many services the patient needs are not covered by the insurance companies at all. This leads to many patients declining to seek out healthcare when necessary. Examples of private insurance companies are Blue Cross, Aetna, Humana, United Health Group, and Anthem. The final entity responsible for purchasing healthcare is the individual consumer. Oftentimes, this translates to the patients themselves. There could be a number of reasons that the patient would purchase healthcare independently. There are instances when Medicare or private insurance companies will not cover the entire cost of the healthcare service. This leaves the patient responsible for the rest of the medical expenses. In some cases, the patient is not part of any insurance plan whatsoever. This leaves the entirety of the expenses to be covered solely by them, which is incredibly costly. The primary reason for this to create a large healthcare inequity is the large amount of expenses the patient is forced to take on. This can oftentimes lead the patient to avoid seeking healthcare altogether. This is one of the best reasons that we as healthcare leaders need to fully understand the healthcare delivery system. Having a full understanding of the healthcare delivery system will help to eliminate situations such as this. Thank you.